Good evening. My name is Felicia Taylor, and I will be talking to you about the PBM reform. Today, I stand before you to advocate for critical bipartisan reform, the SB 669 HB 631, designed to bring transparency, fairness, and cost control to the prescription drug system through pharmacy benefit manager, or PBM reform. For too long, PBM had operated in a space with limited transparency, contributing to rising costs for patients, employers, and government programs. While PBM was originally intended to reduce costs, opaque pricing practices, spread pricing, and rebate structures had intended added layers of insufficiency and financial burden. This policy changes that. The financial problems we face: short-term costs, administrative expenses for regulatory oversight, implementation costs for compliance systems, and staffing for auditing and enforcement. Long-term financial benefits: reduce Medicaid spending through elimination of spreading prices, lower insurance premium due to more efficient drug pricing, increase affordability for patients, improving medication adherence, and reduce costly hospitalization. Study has shown that states implementation PBM reform has saved millions annually, Medicaid programs alone. How we fund this policy? This is not just a reform, it is a financially responsible investment. Here's how we fund it. Number one, allocation of existing healthcare funds. A portion of the current Medicaid administration budgets can be redirected towards oversight and enforcement. By improving efficiency, we'll offset costs over time. Number two, PBM licensing and regulatory fees. Require PBM operating within the state of annual licensing and compliance fees. These fees directly fund the regulatory infrastructure needed to oversight them. Number three, captured savings for eliminating spreading prices. By ending spreading pricing practices, states immediately recover funds that can be reinvested into sustaining the program. Number four, federal support grants. Federal healthcare initiatives increasingly support transparency and cost containment efforts. These funds can supply implementation costs. Number five, public-private collaboration. Healthcare systems and insurers benefit directly from reducing drug costs and sensitizing participation through shared savings models can generate additional funding streams. Why this makes economic sense? This policy does not rely on rising taxes or cutting essential services. Instead, it eliminates waste, improves efficiency, redirects existing dollars to better use. It is a reform that pays for itself and then continues to generate savings. Why stakeholders should support this? The policy makers. This is a fiscal responsibility in action. The healthcare organization. This reduces systematic insufficiency to employers. This lowers healthcare costs to patients. This makes medication more affordable and accessible. Closing. Policies do not succeed on idea alone. They succeed when they make sense financially, politically, and socially. SB 669 HB 631 does all three. It brings transparency where there is opaque. It delivers savings where there is waste, and it puts patients, not the middleman, at the center of our healthcare system. Now it's time to act, not just because it is the right thing to do, but because it is a small financial choice. Thank you. The references for these sites is the Center for Medicaid and Medicare and Medicaid, CMS, PBM Oversight Medicaid spending reports. The reference Healthcare Affairs, article on PBM pricing and drug cost transparency. Reference number 3, National Academy for State Health Policy, the NASHP, State PBM Reform Cases. Government Accountability Office, the GAO, reports on the PBM practices and federal spending. Thank you.